Now we will see the neuroblastoma. A neuroblastoma is the tumor of neuronal crest cells. This crest cell can have the neuroblastoma or pheochromocytoma. We talked about pheochromocytoma in the previous video. Here we're talking about neuroblastoma. A neuroblastoma presents as a abdominal mass. Sometimes can be painful, irregular borders, and can cross the midline. This is as in contrast with Wilms tumor that also can feel as a abdominal mass, but will feel smooth and will not cross the midline, and usually would not be painful. Here this can be painful. This is part of the small blue cells neuroendocrine tumors. Also the medulloblastoma can look similar histologically to this. The histology are neuroblasts surrounding a lumen. It could be something like this, and these are called pseudosettes. Next, they are called rosettes, Homer, right? The patient will usually be a child less than 4 years, and sometimes could have the pain, but also more commonly the mother will bring the child due to the abnormal mass. Sometimes this can be associated with the paraneoplastic syndrome opus clonus myoclonus, that is also called dancing feet syndrome. This is due to antibody against RI in the neurons and present as the feet are tapping and also the eyes like if they were dancing, the eyes. This is the clinical presentation of opus clonus myoclonus. This paraneoplastic syndrome also can be seen in small cell lung cancer. The treatment will be surgical removal. Diagnosis include the CT scan, but also tumor markers will be bombesin and neuronal-specific enolase. This is also seen in pheochromocytoma. Remember, it is a neuroendocrine tumor. The metanephrines could be elevated, at least the vanillic acid and mandelic acid. This will be elevated. This patient, as opposed to in pheochromocytoma, this patient will be normotensive.